Croesawu pawb I briefio eno. Welcome everyone to tonight's briefing. Now, before we begin, I'd like to provide a brief technical introduction. For today's briefing, we're using Microsoft Teams and Facebook Live. If you're accessing this via Microsoft Teams, it gives you the opportunity to see live subtitles of today's proceedings. You should see a button in your settings to switch on subtitles, and subtitles for today's meeting are available in Cymraeg and English, as well as Filipino, Polish, Ukrainian and Urdu. Teams and Facebook both also allow the opportunity for you to raise questions during tonight's briefing. If you've joined via Teams, on your screen you should see a tab with a question mark. This is normally in the top right of your screen, and if you click on that, it gives you the opportunity to ask questions. And if you're watching via Facebook, then you can add questions or comments. Now, please accept our apologies that we may not be able to answer all of your questions during today's meeting, but we do aim to keep our website updated and our social media channels with all of the latest information. Now, today's meeting is also being recorded. Don't worry, it doesn't show any information about you in the audience. Just the information you see broadcast on the screen will be visible. And this means that people who can't join us this evening will still be able to watch today's briefing on catch up. So thank you so much for joining, and our briefing will now begin.
Diolch yn fawr, Adrian. Thank you so much. Prynawn da pawb. Evening, everyone. Lovely to be back with you in 2023, and a very happy new year to you all. I'm delighted to be joining you this evening, just to give a general update and actually to thank you in so many ways for the efforts, the support that is being shown to the NHS and actually the health and care system as a whole during what is a pretty tricky period for us. So I hope to cover some of that ground this evening. Please do, as Adrian says, put questions forward. It's very helpful to me and to the board to hear what is on your mind at this time, and wherever possible I'll try and answer those questions fully, and we will those I can't answer we'll look to provide information. So I guess my theme in some ways is to say thank you for many things, and I'm going to start by thanking you for your patience. It is very clear, if anyone has been looking at the media over the last couple of weeks, that the health and care system has been extremely busy. It is always busy at winter, there's no two ways about it, but it feels really extraordinary, and extraordinary for a couple of reasons, really. We've been experiencing the sort of normal winter pressures probably since about August 2021. So it will have been a good sort of 18 months now that the level of pressure that's come into the system has been above that we would normally expect. And the routine pattern of service is such that some of the seasonal pressures of winter ease as we get to spring and summer, and then and through autumn, and then you really do get sort of a step up in the winter. It has been really challenging for some time, and then of course on the backdrop of things being so difficult, so busy, we then have what I'd call the most extraordinary pressures. So I'm going to just talk a little bit about that, and to thank you. I have had contact with several people who have had some really challenging experience of accessing care. I am very sorry to you and to your friends and your families if that has been the case for you, and I want to assure you that we've been working really hard to try to ease the pressure in the system. Just to share a couple of things that we have been doing. We've been opening more beds. Now that is hard when our press staff are already working at times short-handed. I've talked here before about the challenges of workforce, not having enough staff, and so adding in extra beds, it is a push, but our staff across the system have risen to that challenge, and they've been fantastic. But I know that the delays that people have experienced, both in terms of getting out of hospital and also then, of course, getting into hospital, have had a real impact on people. We've got a picture of the ambulance there on this slide. I know that working closely with colleagues in the ambulance services, they're desperate to be able to offer a more timely response to people, and we're working very hard to try to ensure that when ambulances do go out to district general hospitals, that they don't get stuck for too long there and they can be back in the county. So that's a real priority for us. You know, I don't want to get too far ahead, but I am really hoping that the sense of the winter respiratory viruses will start to ease in the coming weeks, but we're not taking our foot off the accelerator, so to speak, in terms of providing, you know, additional beds and additional support. The root of some of the challenges here, of course, is being able to provide enough community care support, and that is a really important priority for us and for Powys County Council, and we're working very closely together on that. There are, of course, things that we can all do as individuals, and I hope that this is helpful to you, but we've got an information hub on our website, which is a help us to help you. So there are things that you can do to try to find the right care at the right place in the right time. So hopefully that's helpful. But thank you for your patience. I also want to thank you for having your winter vaccinations, and you know, I'm a big fan of vaccination, and we started many of these briefings because of the huge interest in what we were doing about the COVID-19 vaccination, so some years ago. And just to say that vaccination continues to be our best defence against winter viruses, particularly COVID-19 and flu. You know, we know that we've had some challenges around strep A as well, and that's coming. And I think it's the combination of these viruses coming through in such high volumes that has significantly contributed to the pressure in the system. So I was delighted to hear yesterday that 80% of the eligible population for their autumn COVID vaccination have taken that up, and that's phenomenal. There's still room, so 80% isn't 100%. So, there's still room for those who have not quite got round to it to get back in touch. And I particularly want to invite you to come and get your flu vaccination. So flu uptake rates are not as high as the COVID uptake rates. So there are people who've yet to avail themselves of that vaccination. We are running drop-in sessions. My understanding is just in the last few days, 50 people have come through those drop-in sessions and had their flu vax. So others are using that. It's there. It's free. It's available. So if you're over 50, you are eligible. If there's any doubt about your eligibility, though, please do go on to our website. There's a page there with flu immunisation and a page with COVID vaccine. I was fortunate. I'm in the eligible groups. Had both at the same time in the same arm. Was perfectly fine. Fantastic service, and so please to encourage you to do that. Can I thank as well the staff who were involved in vaccinations. You know, we never envisaged that we would still be looking to vaccinate quite so many people quite so often, and I know that we'll be thinking now about a potential spring campaign, and we don't know the detail of that yet, but we're now a couple of steps ahead of ourselves all of the time, thinking about what comes next. And it was great to have the Minister for Health and Social Services come to see us in Powys. Powys is one of the areas with the highest uptake rates of the COVID vaccine, so she was very keen to understand how we had managed to do so well. And most of the time, the success is absolutely down to people in Powys pitching up, and also staff who are very flexible in taking out those vaccinations. Important role for primary care here as well. So I would like to thank our colleagues in primary care. It's a tremendously busy period for them, and yet they are still being able to offer vaccinations locally to very many people. I'd like to thank people for their kindness as well in terms of it's a tremendously difficult time, not just for the health and care service, but for the country, you know. And I look at I look at the news. People are experiencing some real challenges around cost of living, etc. But also, you know, strikes, industrial action happening, and you know, this is in no way, we don't make any political comments, but we do observe the strain that people are under, both people who work in our health and care system, but people who are trying to access that, and people in our communities. So it's very understandable that people get very cross and frustrated at times. But I would say that, you know, I've had such lovely reports of people extending that extra bit of kindness to colleagues and people who were working very hard and doing their absolute utmost at a time of difficulty. We do have approaches around abuse and aggression. It is not tolerable, and it is something that we encourage our staff to report so that we can support them and actually try and support the person that perhaps is extremely frustrated. But there will be times when we need to take things further. So thank you for being kind and understanding to our staff. And it goes a long way. It really does go a long way, and I look forward to hearing more feedback about some of this and about access to our services. The next element is, you know, where we are currently with the position in winter, and I was sort of alluding earlier to COVID waves, flu waves, and respiratory viruses for winter. So it does look as though we have been in the 5th COVID wave, and the numbers a bit early yet, but look like this just starting to subside. If you're like me, I've met so many people over the last couple of weeks that have been unwell over the Christmas period, the holiday period, getting over coughs, colds, flu, COVID. So we know that a lot of people have been affected, and the numbers that I saw from the Office of National Statistics indicated about 1 in 22 people at one point had COVID infection. Flu, the rates are were high. We again hope that we've just passed the peak of that, but the impacts of the numbers have been really significant. So hospital admissions very steeply increased in the run-up to Christmas, and maintained that level to a level that we haven't seen for a very long time with flu, but then combined with COVID, one of the main reasons for people being admitted into intensive care was flu. So especially if you have an underlying condition, I would really encourage you to get both jabs, flu and COVID. If you have symptoms, please stay at home, avoid contact with other people. And while I've seen an increase in people wearing a mask in all sorts of settings, please do consider wearing a mask. It will signal your intent and your commitment to preventing infection, and of course all of the things that we're used to doing now, hand hygiene and those sorts of things. So again, huge thanks to people for coming forward with their flu and their COVID vaccination, but there are more people who can make themselves available for that, and we're here waiting to help you. And then I'd like to move to something I touched on a little bit earlier, really, and that's about the general cost of living challenges. I was listening to the radio the other day, and I heard that gas prices are starting to come down, and I thought, thank goodness for that. But I then heard a slight qualification of that. Of course, they're starting to come down, but they're still at a very high level. So we know that especially this time of year is the time that we would really encourage people to heat their homes. We know that there are really strong public health impacts of not being in a warm environment. And there was advice earlier on in the season about warming the body, not just rather than warming the room, if that was the only thing that you could do. But I've been hugely impressed and delighted to be working so closely with Powys County Council about sharing the information about cost of living information hubs. There's plenty of information on our website. It's advice and support that is available to you. And I've been keen to understand, excuse me, hope I haven't got anything coming, warm spaces directory that is available on the Powys County Council website. I think we had that very, very cold spell, didn't we, in December. The weather's been a little bit kinder on the temperature over the last couple of weeks. We've had so much rain to make up for that, of course, but we don't know what's coming. So it may be worth just having a look at the warm spaces directory. And a lot of people have helped to make that happen. And please do, if you think that there's a friend or a neighbour or yourself might benefit from that, please do share the information. I'm also keen to thank the significant number of contributors who make Powys such a fantastic county, of course, and carers, befrienders, volunteers, and so many more. Many groups in our communities are supporting each other, and it's a bit of a standout feature, I think, of Powys, and I'm always very keen to tell others about that characteristic. And there's an opportunity to celebrate volunteers, and the nominations for the Powys Volunteer of the Year Awards are now open, and they'll be open until the 5th of February. I've been lucky to be invited to those award ceremonies. I'm absolutely blown away each time I go about how wonderful people are and the diversity of volunteering that is available here in Powys. A couple of important notices really to draw to your attention in terms of some of the engagement and consultation where we're seeking your views on things, and it's an opportunity for you to have your say. And already on one of our consultations, 500 people have already had a look at the material that we've put there. So I'm going to cover off just a couple of these things. We're seeking your views on health services and how they should be delivered in the future. Some of these health services aren't necessarily provided in county. And that is true of the first one I want to flag to you, which is about cochlear implants and bone conduction hearing implant services. For people who don't know what a cochlear implant is, it is a device that is embedded here into the bone there, and a hearing device, like an internal hearing device. We secure the services largely from Cardiff and Vale Health Board. So Cardiff have a unit for cochlear implants, but Swansea have also provided this service in the past, and there's a consultation about whether all of those services should come together in Cardiff. So if that is of particular interest to you, please do have a little look on our website, because we'd be very keen to hear your views about that. And that consultation is open until the 14th of February. So you've got a little while longer, but be keen to hear as many views as possible. The process then is that once all of the views have been submitted, they're actively considered, and they go through then to something called the Specialised Services Joint Committee, which I'm a member of that committee, and we have a look at that, and we then discuss that at our board as well. So these procedures can be life-changing for people. So it's a really important service. The second Have Your Say opportunity is an application in Gelwyn. So the Belmont surgery, which is just outside the Powys sort of footprint, but we know people from Powys use the branch practice to the Crickhowell practice there. So, and it's in Gelwyn. So we're working with the Aneurin Bevan Health Board because we've had an application, or there's been an application made by the Crickhowell practice to close the Belmont surgery. I think there's lots of challenges in amongst the provision of primary care, their building challenge, often staffing challenges, as everyone will be aware. So that consultation is running until the 6th of March, and delighted that people have already gone onto the website and had a little look at that. We're trying to raise the awareness. So if you know people who live in that area who may be affected or may be a patient, particularly in the branch surgery, if they can have a look and let us know their views. But the process on that is those views come in, we have a look at them and then consider the action that we can take. You know, with the practice. Very important that the practice's role in this service provision or locally. And then the last one, but certainly not least, is the Wales Air Ambulance Service and EMERTS. So EMERTS is the Emergency Medical Retrieval Treatment Service. So this is the air ambulance with the paramedics all on board, you know, and well, not just paramedics, we have consultants, and it's a bit like an intensive care unit in the sky, and along they come. So that service is actually provided both in the sky, the helicopters, but also the vehicles on the ground, and has been a very important service for the people of Powys. It first started in 2015-16, and there's been an intention and actually some steps to expand the service. And there's a key issue now about whether that service can be expanded further and how best to achieve that. There's plenty of information on our website if you wish to have a look more closely at that. The mechanisms for making decisions on air ambulance services is in what's called EASC, so Emergency Ambulance Services Committee, and again I'm a member of that on behalf of Powys. So it's a very important development. It's a very important service for us in such a highly rural area. So we're very keen to again ask people to get involved in some of the considerations around that. That engagement consultation has not started yet, but there is background information. And again, we'll be coming back to people of Powys and publicising a bit more on that in due course. Hopefully over the next month to 6 weeks, there'll be some further developments on that. And then finally, my last slide really is to recognise that next year, this year, goodness me, this year, the NHS is going to be 75. And, you know, amongst all of the challenges that we are currently facing, you know, we still have significant backlogs of planned care activity, outpatients and treatments. Although Powys has done, you know, we've done very well here, we still know that there are people waiting. We've also had challenges, of course, with winter, but it's really important for us to reflect on the NHS and what's been achieved since it was established back in 1948, and looking back, but also then looking forward. So what's the next 5, 10, 15, 20 and more years going to be bringing, and the changing shape of health and care services. And it'd be really helpful for us to have that conversation about what health and care needs to look like in the future. And I'm very keen over the next couple of months that we indeed do that, and we start to design and redesign services that best meet the needs of the population. We know that our population here in Powys isn't growing particularly, but the profile of it is changing. So we will have more people who are over 65, 75 and 85, and we'll have a reducing number of people, working age people. So that brings some real challenges. We're not alone at all. There are countries across the world that are trying to grapple with that. And whilst it's hugely successful to have so many older people living longer, we know that people need care and support in the latter part of life, and we've got to change the way in which we can support people, and those conversations are going to be very important. It gives an opportunity as well for me to ask you, how should we celebrate, mark the 75th birthday of the NHS? And always open to hearing thoughts and comments. And it may well be a very important time to recognise both individual, team and collective efforts. And just on that subject, I was delighted to see that in the King's New Year's Honours that Dr. Andy Rainsford from Llanidloes was awarded the British Empire Medal. For those of you who know Andy, he's been hugely committed to both Llanidloes and the people of Powys more broadly, the NHS and of course to medicine as a profession. So I'd like to extend my huge congratulations to Dr. Rainsford for that recognition. But there'll be many more people in Powys for whom that sort of recognition, whether they work in the NHS or in other settings, there are shining stars, often quietly, diligently getting on with making a positive difference to people's lives. So it feels like maybe it's a year to recognise some of that. Now, this has perhaps been a little bit more of an unusual briefing as we start the year, but felt important to take an opportunity to explain some of those very real pressures, but to thank both members of the public, our communities in Powys, for their patience, but to thank people who work in the health and care system, not just in the statutory sector, but the volunteers and other community groups for everything that is being done. We have been through very challenging times before, of course, and we find ourselves in another one of those, but brighter days will come, I'm absolutely sure. So in the meantime, diolch yn fawr, please look after yourself, don't forget the vaccines, and Adrian, on that, I'll probably draw it to a close and see if we have any questions.
Very many thanks, Carol. Certainly covered an enormous amount of ground in that briefing, and hopefully our viewers tonight and who watch it on playback found that a really useful overview of some of the issues that we're all facing at the moment. As you can imagine, I think the message boxes are quite full around those emergency care pressures. And I guess what's your top message for people who are experiencing difficulties in accessing urgent and emergency care? And what do you see as the way through this?
Yeah, thanks very much for the question, and quite understandably a big issue, a big topic. The first thing I want to say is that if you have a life-threatening condition, the NHS is here for you. You really should ring 999. There are people who will help to work through sort of the questions to understand what type of response is best for you. So I want to start with that, Adrian, because the media is full, rightly so, of the challenges of the NHS, and I don't want people in Powys to be put off if they have a life-threatening condition, believe they have, from ringing 999. So that is important. But there are so many other ways of accessing some advice and support. So there's a NHS 111 website, and that means you don't have to wait for anyone to answer the phone. You can have a look. There's some really excellent guides. There's some guides on our own websites as well. So if you think you've got something that might need some advice and support, then that's a good place to go. One of my family members went to the pharmacy a couple of days ago, and actually the pharmacy service was able to offer some advice, support, and some medication under something called the Common Ailment Scheme. It saved them from having to go to the GP. The access was easy, and it was a very sort of pleasant experience. Our primary care service is still there. It's working extraordinarily hard, not least because, of course, all these winter viruses, we know people who've got some underlying conditions, things can get on the chest or whatever, and you naturally ring the GP. Please do have patience with colleagues in primary care. They are working so hard to try to respond, and in some cases the numbers of calls that have come through are double what is normally expected. So they will work very hard to get to you. So your GP is still there, but there are other mechanisms as well. The NHS 111 service is there to offer advice and support, and ultimately, Adrian, that the sense of the breadth of advice now. In the old days, it would be GP or A&E. There's multiple places. If people would find it valuable, please go on our website and go on the website of NHS 111.
Thank you, Carol. And I actually had to follow our own advice recently. I had a bit of a dental emergency, so used the 111 emergency dental line, and it was really reassuring how I was then referred through to the local service for an emergency dental appointment to follow that up and get some emergency fix for my teeth. And I think that leads into one of those big topics as well in the inboxes tonight, which is people are saying access to dentistry is still a real challenge in Powys. Are there any glimmers of hope there?
Oh, well, I'm glad you were able to access that. That's a good story, Adrian. Thank you for that. Yes, indeed, dentistry is a big issue, and I think we've covered some dentistry briefings here before. But probably to bring everyone up to speed, there's two pieces of positive news that I can offer. If you're in the Llandrindod area, you may well have picked it up already, but just at the end of November, we were able to inform people that there's new provision coming into Llandrindod. It had been an area that was particularly struggling with dental access, so really pleased that new service will be there for people in that area. And additionally in Brecon too, so a new provider coming into Brecon. Again, these are very important services. We have, of course, got a lot of change happening in dentistry, and I think we've said previously about the way in which new roles are coming through, new jobs, so dental therapists, for example, rather than just a dentist. So people will increasingly see different types of dental services coming forward. And now I don't want to pretend that we're going to fix this overnight. This is quite long term, but step by step. And these two important new services coming through are a really important step forward. So I'm really pleased about that. If anyone's watching this who has a concern about trying to get a dentist, we do run a dental support line in the Health Board. That has helped over 5,000 people so far. So please do get in touch with us, and we will try to help. And then, as Adrian said, I'll just reinforce that if you have a dental emergency, 111 is there to guide you. So some progress on dentistry, but it continues to be one of the top priorities for us.
Thank you, Carol. And clearly a key part of our local dental provision as well is our own community dental service as well. So big thanks to them. I think one of our locations where the mobile dental unit has been based has been Brotherthy Hospital in Machynlleth. So how's the progress on that? Are we still on schedule to open this spring?
Yes, Broderby has been a development that has been long in the making, a couple of challenges along the way, but I think I've reported here before such good progress being made, and that spring date remains a very real date for completion. I always sort of hesitate a little bit because, you know, we can have bad weather and all sorts of supply chain issues, of which, you know, that's becoming a regular feature. But we're confident that spring is going to be achievable. And in fact, I think there's an event just this weekend, one of the art sessions that has been put in place. The community in Machynlleth have been extremely patient with us while we remodel the site and we develop that, but also very helpful in working with us on some of the designs, particularly around gardens, but also around art and how the facilities will look. I'm hot-footing it to Machynlleth myself in February just to check in on progress. I was there a couple of months ago and more than a couple of months ago now, back in this better weather, and that was coming along nicely. And then I saw Machynlleth on the BBC News, I think it was the other day, about the town clock. So I understand that there's efforts around getting the town clock back working. So quite a lot going on, as always, in Machynlleth. So thanks, Adrian. There's it's been a very busy year for colleagues in the capital development field, and just to say, our Brecon car park development is very near to completion as well. I think it's that's been a long time coming, and I'd like to thank everyone who's been part of that, because that's been a public and an NHS endeavour as well. And maybe in one of these sessions I can give a bigger update on some of the building and capital developments that we are working on.
Yes, I must admit too that we're just about to put news out about imminently that are probably interesting to people watching today. Firstly, just to let people know, we will have a temporary closure to our birth centre in Llanidloes for a little while, because we've got some great new developments there about improving the birth facilities and a new birthing pool. So just in the process of writing to any expectant mums in the area to talk about all the range of alternatives, and then by the spring there'll be a fantastic new facility there. And then also we've been really grateful for some funding from both the local League of Friends and the National Lottery to create a new sensory garden alongside the ward as well. So those are news stories we're just about to put out. Thinking more widely about some of those issues that you've raised today, I know that a lot of people are still very anxious about COVID vaccination, and one area of inquiries we do get is whether we do think vaccination might be expanded to the under 50s at all. Is there any intelligence on that at all?
Yeah, thanks Adrian. And you know, how fantastic is it that everyone's interested in vaccination, and it is, you know, one of the single most effective interventions in preventing ill health. So I'm delighted that people are interested in that. So it is the Joint Committee for Vaccination and Immunisation that really give us the guidance around who is eligible for vaccination and when. So I alluded earlier to the potential of a spring campaign. We have been undertaking the boosters now for some time. But as you say, Adrian, the eligibility has been for people who are over 50 or those with a specific underlying condition. At the moment, I have no official intelligence that is going to be expanded. But we are expecting some update from the JCVI in the coming weeks, and so I don't want to give a firm answer either way. Really, we're expecting to be further updated. But it is really important that we've still got quite a lot of people who are over 50 who have yet to have their vaccinations. So again, another plug to encourage people to have that. There are high levels of immunity to COVID, but we do have these new strains that come through. So for us not to rest on our laurels there, but to also think about maintaining our levels of immunity. As soon as we know, Adrian, I'm sure we'll let our communities in Powys know.
We will indeed. And just a quick reach back to one of our earlier questions. I must admit I didn't have this telephone number at my fingertips earlier. You mentioned the Powys Dental Helpline. That's for anybody who needs assistance finding an NHS dentist who lives in Powys, and that telephone number is 01686 252 808. That's 01686 252 808. Now, our next questions, clearly industrial action is something that's been affecting patient service users in the NHS recently. Now, I know that NHS pay isn't determined locally by individual health boards, but how's industrial action been affecting our services? How are we responding, and can you see a way out of it?
Oh, they are big questions. Can I see a way out of it? Absolutely. Well, today there have been some meetings in Wales between the Welsh Government ministers and trade unions. I haven't seen what's come out of that, but I really do hope that progress is able to be made through negotiation. I think very genuinely people care about the NHS and social care system and wider services, of course. And everything we've been through over the last couple of years and the challenges we have now have brought it all into pretty sharp relief. How has it been affecting us? Well, we have been planning, and I've got to speak very positively of the relationships that we've had with the trade unions who have already undertaken industrial action in Powys. We have a very different shape of service here, of course, with the sparsity of our county and services being spread out rather than in one place. And I think we've been able to negotiate a good way of covering services, but also to understand the right of people to take action, to take strike action. So far, we have been able to maintain the lion's share of the services. Now, as we go forward, more and more industrial action will challenge us, and particularly where there's multiple trade unions taking that action on the same day. So it is an area we're keeping very much under review. We have our ear to the ground about when things are going to happen. And of course, we're also picking up some of the wider action that affects people. So, for example, teachers, I understand, are being balloted, and some of that industrial action will affect us, rail services and etc. So, Adrian, it's a tough time for everyone, for those running services, but particularly for those who are in the service and trying to provide a service on the backdrop of what's a really hard cost of living problem. So I do hope it gets resolved. I'm an optimist about finding dialogue as a way through a negotiation. So yeah, let's see how that works through over the next couple of days and weeks.
Thank you. And I think that just about brings us to a close for this evening. Clearly, for many of us, the weather outside is pretty frightful at the moment. So I think there's a really important message to everybody to stay safe. Look out for those weather reports, travel and traffic reports, and flooding reports. We've been sharing information through our channels to help everybody stay safe. But as we look forward to the spring and the brighter, longer days, have you got any final closing messages to share with our viewers tonight?
Well, I'm thinking about daffodils, and I perhaps share a little story that my poor old mother-in-law wasn't very well. She had this whole horrible winter virus, and I saw in the supermarket they were selling daffodils, and I thought that would bring a little bit of spring optimism to her. So she had a couple of bunches of daffodils, as did I, and so the next time we meet, I hope, Adrian, it'll be a little drier, a little warmer, a little lighter, not just on the weather front, but on all fronts. And we will have moved through this slightly tricky period. And just to reiterate, please do keep as well as you possibly can. Our NHS is here for you. We're doing our very best to support you, and thank you for all of the support. So diolch yn fawr iawn. Thank you all very, very much indeed. And thank you very much, Adrian and team, for supporting this public briefing.